like to share my experience of being a nurse over the last 10 years and working in healthcare even longer. I've had the opportunity to experience many different varieties of interactions with healthcare workers and their patients. So let's go ahead and we'll get started. As soon as I share my screen. Okay. Here we go. So this is where I like to start, just because if you're being told to be an advocate or somebody was advocating for another, what does it actually mean? So pleading the cause, pleading your case, telling your provider, telling another person what it is that you actually need or desire from them or that interaction. Advocacy is the act of doing that. So being the advocate, being involved in advocacy is really supporting yourself. My proposal is that I receive X, Y, Z, and here's why. Being able to explain why that is you are wanting to achieve that outcome. So as the patient, the reason that it's helpful to advocate for yourself or to be advocating on the behalf of a patient improves the odds for better patient outcomes. That is something it's going to help with the provider to understand the specific needs of that patient, reducing their anxiety. It facilitates better communication with providers, potentially improving that patient's understanding. When you have that increased level of communication, there's just more interactions, more opportunities for the provider to explain why they've chosen a specific treatment recommendation and how it works. There's also benefits to dependent adults. If they don't have the ability to accurately express themselves or describe their symptoms, it's going to be very difficult for that provider to actually figure out what it is that they need, how to diagnose them. They gather much of their information from the patient themselves. So having someone there to advocate on their behalf, someone who knows them very well, who can describe their symptoms and their history, is going to benefit that person immensely. It also demonstrates a commitment by that patient. I'm going to actively participate in this plan of care that I'm requesting from you. I'm going to participate in this treatment. I want to meet my healthcare goals. I'm showing you that, I'm demonstrating that because I'm asking a lot of questions. I'm showing you that I'm involved in this interaction and I'm going to be a participant. I'll follow through with what you tell me to do. The intention of advocacy, I just wanted to point out, is to improve the outcomes. And it should be noted, avoiding association with criticism of the care is not necessarily patient advocacy. When you hear of situations where people have not been satisfied or been upset with the way that their healthcare was managed or how it turned out, you often hear of the criticisms. And I told this doctor, no way I'm doing that. Basically, being a little bit aggressive with that interaction. That's not necessarily how you want to think of an advocate. And I honestly don't think that's a very large majority of patients anyway. So next, I'd like to discuss what it is to be an advocate as a nurse. In the nursing profession, advocacy means to preserve human dignity, promote patient equality, and provide freedom from suffering. Nursing advocacy is also ensuring that our patients have the right to make informed decisions about their own health. Also, as a nurse, the level of involvement is based on patient need and dependence. For those that have a greater need, the level of involvement would be higher, and that patient would receive more intervention and more advocacy from the nurse. Um, in, in patients who are very high functioning and demonstrate a need for some dependence, that level will change kind of individually. And in my experience, that's how I've always tried to acknowledge these needs that patients have as far as acting on their behalf. And it is a personal gesture. It is something that it's important to be mindful and consider that person's acceptance of this intervention that is being provided. Um, you can offend people, and it has happened in the past to me. If somebody doesn't want an advocate or to be advocated for, it sort of takes away a bit of their independence to do things on their own, and it can be upsetting sometimes. So kind of getting to know your patient a little bit is important, or as the caregiver, it's important to know that for those that you care for. And always being able to support that person to retain their independence is going to help you in the long run, both you and the patient or yourself, even if it's telling your provider that you don't require as much intervention as they are maybe thinking that you need. Creating more burden on the caregiver kind of comes from allowing that person to have this increased level of their needs met. Somebody is providing more assistance than somebody actually needs. And that in turn will create a dependence on that caregiver to continue providing these services or interventions. And that's kind of an unnecessary burden. So to promote your own objectives within healthcare, usually this will be during a medical appointment or some kind of interaction that you have with a specific clinic that you're getting services from. Speak up. That is probably the number one thing that you can do. If you don't say anything, your provider won't know that you have a concern. These quotes are very, very common. I don't understand. I'm not able to read this. If they're providing written information, maybe a lot of things are coming at them really fast and a lot of information is being explained all at once. I'm feeling overwhelmed. Can I have a break? I'm not sure if I want to start a new medication. I'd like to think about that. I'm worried my loved one will not tolerate this surgery well. Can you help me understand why you're recommending it? It's all things that relate to the patient asking more from their provider, more explanation. Being prepared. This is very, very helpful when it comes to attending these medical interactions, because you're going to want to make a list of discussion topics. I always recommend people take notes and keep a piece of paper with them, something to write it down on when they think of a question or something they don't want to forget to ask during their appointment. Keep all this written information that you do want to remember in a designated spot. Maybe you have somewhere on your kitchen counter that you can keep it, maybe next to your bedside table, in your purse, somewhere that's easy to access. Bringing any relevant medical information like a medication list, personal emergency contacts, insurance information, and contact details for other medical providers. These are things that get covered almost every single medical appointment that I attend. And I attend quite a few of these medical visits with our participants in our program. So these are very important for your doctor to know, especially the updated medication lists. And this can be even more important if you have multiple providers and they're all prescribing different medications for different things. In order to make a good clinical decision, that provider, whoever it is, whoever you're seeing for that day, does need to know an accurate description of exactly what medications and what amounts of those medications you're taking. And the personal emergency contact info is very good for maybe a situation where you're not able to communicate to healthcare professionals, especially in an emergency-like situation, or if you're traveling. Insurance information, that's always something that's helpful, and to keep up to date in medical clinics. And contact details for your other medical providers are going to help to facilitate communication among those providers if they do need to consult with each other for any reason. And this is actually one of the things that we do at CNR is we keep a binder with all of this information up to date, and we help participants keep that readily available for any medical visits that they attend. The reason for that is with the clients that we serve, a lot of times there are things like memory deficits, and people won't necessarily remember all the medications that they take or who their other doctors are. So this is really helpful during any medical appointment. Also avoiding aggressive or confrontational behavior. As I had kind of mentioned before, this sends the wrong message to your provider. If thinking that advocacy is standing up and kind of being macho or letting that doctor have it because they made a decision you didn't like, it's not necessarily the same thing as advocacy. So I'd like to also discuss the types of medical providers, just because there's been a lot of question in my experience with different providers being involved in people's medical care. And honestly, it's more confusing than I had first anticipated. And it's something that I discuss often with the clients that I work with. The different kinds of providers that you're going to have really need to start with your primary care provider. And this is sometimes a general practitioner, GP, family medicine doctor. Those are different things that they are called. And it's your primary provider because they're your go-to provider for almost every health-related issue that you're going to come across. What you want to make sure is they are involved in some way, whether the heart doctor is sending notes over to the PCP, or they're, consulted for a situation and maybe you're not sure who to ask, or you're not sure what kind of doctor you should be seeing. That's something that they're always able to help facilitate, navigate you to the right kind of provider. Another thing, if you don't have a lot of experience in the medical field, is to ask if they have a release of information on file for you. This is very helpful when you have other people that are in your life that you want to be able to communicate with that provider, with that doctor, and discuss medical related information on your behalf, as well as other medical doctors. If they're not involved in the same practice, if they're under different medical groups, they will need a legal document signed by you saying that it's okay for them to talk. Otherwise, it's prohibited by law, and they won't be able to share that information that could potentially lead to better treatment for you in the long run. It's not impossible for doctors to treat people without these, but they are very helpful. Also, it's good to know about the primary care provider is establishing that relationship. It benefits you in the long run. They get to know their patients better over time and can make a more informed clinical diagnosis and better treatment recommendations once they get to know you better. So they're just good to have on deck. Other types of providers that I would like to discuss, and this is not a complete list, it is simply some common different specialists that I have come across and that I discuss with my patients often. They have different names for different specialties. So if you are speaking to somebody and you're talking about their orthopedic appointment that's coming up to check on their ankle and see how the fracture is healing, maybe they don't know what that word means. Orthopedics does not, and I guess, signify bones to a lot of people. So it's good to know what kinds of doctors do what things and why you are seeing a specific specialist. And oftentimes they're referred to these clinics by the primary care providers. So it's a pretty good guess that you're in the right clinic if your primary care sends you there. I also at the bottom wanted to point out a slight difference between a psychologist and psychiatrist, really just because I do get a lot of questions about this. It's something that I discuss often with our participants. And the psychologist is a doctorate. They have a PhD. They can diagnose and treat with counseling, behavioral therapy, cognitive behavioral therapy. And a psychiatrist is a medical doctor who went to the same school that your primary care did. And then they kind of branch off and specialize into these different types of clinics and these specialty programs, but they will treat mental health conditions with medication. And a lot of times the psychologists and psychiatrists do work together on that, I should add. And that's where the ROI comes in handy. So how do you manage all these different providers? If you have a lot of different conditions and you are being seen by multiple different providers in many clinics, make a list. Again, lists are great. Using an address book, phone app, tablet, computer spreadsheet, notebook, journal, anything that's convenient for you, easy for you to keep track of, has a dedicated spot for you to keep it, and you're able to quickly access it if you need something in a hurry. ROIs, a release of information, is important, again, to let these other medical clinics and providers communicate with each other. And also, and the reason for that is it can delay treatment if you don't have that ROI. It's certainly not something that you can't get after the fact. If someone decides, oh, wow, gee, I didn't know you used to see a cardiologist for 10 years before you moved to the area. I think I'd like those notes. You can always sign a release of information during your clinic visit. It just does take a little extra time to obtain those records and review them before they're able to proceed with your treatment plan. And providers are scientists by nature, which is the reason more data is helpful, because the more that's available, the better they can treat their patients, the better they can assess what's going on and kind of gather that information. Doing your homework is really helpful too. Really what I stress to the people that I work with is to learn about your diagnosis, but avoid trying to diagnose yourself. I know that's kind of the joke you hear about, or Google diagnosis, right? I looked it up on Google, so I must have it. So definitely be careful of misinformation online. But if you have been diagnosed with a condition and you do want to learn more about it and the ways that it's treated, really good resources I've listed here below. These are all government websites, and they're actually the very websites that I look to when I want more information about a specific condition or a topic. Appropriately using services is going to help you as well. So medical clinics are able to answer patient questions, provide advice over the phone in many circumstances. If you're an established patient within that clinic, chances are they have plenty of information on you already. And when you do call, you generally speak to a nurse, and that nurse can kind of triage what's going on. Is this something that, we really need to see you in person for? Is it something we can handle over the phone? Is it a medication refill? Maybe it's as simple as that. And a lot of times they can help out and relay that to the doctor and get you taken care of. And if you're not really sure if you need to make a clinic appointment or not, call and ask. They'll help you. And the primary care is always a good place to start, especially if you are on the fence about something. I'm not really sure if the symptom is, bad, or if it's just, am I exaggerating something? I'm not really sure. Call the primary care. And if they don't think that, I don't know if we are the right place for you to call, they'll let you know. It's easy to become discouraged if you are kind of feeling like you're getting shuffled around a lot, if there are multiple different transfers on a phone call, or you're being referred and sent to all these different clinics, it can be really difficult and frustrating for people to kind of feel like they're being treated equally, I guess. But it is done to help best meet your needs. So if you remain patient, they should get you to the right spot. Medical providers can also give you direction on what other types of services that you might need or benefit from. If you're having balance and gait issues, they might send you to physical occupational therapy, swallowing. Oh, you're having difficulty swallowing your medications, then that's not really a good thing. You need those. So sending you to speech therapy could help out with that and kind of strengthen the muscles in your throat and help you be able to swallow. If you are identified as someone who could benefit from a walker, a wheelchair, a cane, they could send you to a durable medical equipment store, and they can actually write orders for you to obtain that equipment. And a lot of times insurance will be able to cover some of the cost of that. And also your levels of care if you need any kind of inpatient medical care. And the different roles that a medical provider plays. They help diagnose and treat conditions. They base that on the evidence that you provide, empirical data, subjective information. They gather that during the visit. Once again, science, more information, better diagnosis. The information is collected several ways. So the patient's, your report, the patient advocate report, medical history, lab values, other test results, observations that they note during their assessment, information collected from previous medical providers. Hopefully you sign the ROI so they can get that. They also have all taken an oath, I believe it's the Hippocratic Oath, to do no harm. They are there to help, to heal. Medical staff are healers. And they do weigh the risks and benefits of every recommendation. A lot of times, if you think of surgeries, there's always a risk involved, even with a minor surgery. The same thing goes with medications. So you could take a very, very strong antibiotic, but it's going to cause you a lot of negative side effects. Maybe you don't need that strong antibiotic and you could use a very mild one and get the same results. It's equally as effective. So they'll weigh the risk and benefit and give you the milder antibiotic. They're also taught to follow best practices. So when they are coming up with a plan for you, sometimes it means you might have to try multiple different options. And I know sometimes that can be frustrating for people too, because, gee, I already tried 2 things or 3 things, and now you want me to try something different because those other ones worked. What makes you think this will? They're basing that off best practice. They always start with the least risky, the least invasive, and then kind of proceed on to the more high risk ones. And that's where that weighing those risks and benefits comes in. A lot of times insurance will also play a part in this because the expense of different treatments and likely outcomes. They obviously are not in the business to take huge losses with these very expensive treatments that people may not actually need. They're also trying to work with their patients to meet those needs and provide autonomy. So you do have a say in your individual plan of care. Many people hold these medical professionals up on a pedestal and do not question or argue anything that they provide for information, which I'm not suggesting that people start arguing with these medical providers, but I would say to ask questions, ask as many questions, ask the same questions over and over. Maybe they'll tell you a different way. But you do have the right to accept or refuse that treatment. And you do have the right to understand what it is it's being told to you and what recommendations are being made. So they also acknowledge the concerns of their patients and explain their rationale. If they've made a recommendation, they should be able to tell you why. I guarantee you that they have a reason. And if you don't understand something, again, say so. If you don't understand still after asking, continue asking. Maybe they can provide you with a different form of information. And this is something that can be very helpful, especially when there are disabilities that are causing different kinds of deficits in people who may not be able to read or understand spoken language as well. There's multiple ways to convey information to patients. They can also sometimes provide additional resources if those are available. Maybe there's a great webinar or a video that's online or website dedicated to whatever information that they're trying to discuss with you that day. They also can remain available, and they are available by phone or email, whether it's directly to them or to other medical staff in their clinic. They are available for questions or concerns. So you don't have to feel completely cut off after your visit if you did forget to ask a question or bring something up. It's not necessarily something that you have to just forget about till your next visit. And they also treat all patients with dignity and respect. That is an expectation among healthcare workers in general. Medical providers will continue to work with patients even if they don't follow through with every recommendation. A good example of this would be, I recommend that a smoker quit smoking, but I won't turn them away as a patient anymore if they continue to smoke. It is a common thing. I think that respectful relationship is definitely considered when that sort of thing is involved. So there have been instances, though, where people who miss appointments continually or have very inappropriate behaviors during medical visits with no resolve to those might be asked to find a different provider. So that's a little disclaimer, I guess, to that. Medical providers can also recognize when a patient might not be suited to continue with them in their practice. There are some times where personalities just don't click. People aren't getting very far with their healthcare goals, and the provider might suggest that maybe the patient go to a different doctor, a different clinic. And really, there has been a fair amount of thought into that if that's the suggestion that's being made. Usually that's done with a little bit of care. It kind of depends on the situation, but if a provider were to suggest that their patient go to a different clinic, it's usually for a reason. And the reason is improvement of healthcare. So as far as the patient responsibility and what they should be responsible for, the expectation of what they can be responsible for is to take on that responsibility. I choose to be responsible for my healthcare or to the one who depends on me. So obviously, medical care is a treatment, a service, and it's intended to increase the quality of life. So maintaining your scheduled appointments is another responsibility. Attending these consultations, doing the testing that's ordered, following the treatments and plans of care that are agreed upon. Those are kind of the responsibilities once you have requested that service of medical treatment, once you've requested this intervention. Hey, I have this problem and I want you to fix it for me. The doctor will lay out a plan. This is what I'd like, XYZ. This should be the best course of treatment for you. So following through with those things is a responsibility of that patient. If you're not satisfied, let someone know. If you're not happy with the way that the treatment went, if you don't think that your doctor had done enough, let someone know. Chances are they're going to be able to explain to you why they've made that clinical decision, and hopefully you can agree how to resolve the issue. So tips for achieving this good communication: arrive prepared. Hopefully you have your list, your binder, your folder, whatever you have made to hold all this medical information that you have. It's with you and you've thought ahead, you know what you want to discuss, and remain objective. Be honest. Be honest is about everything. Medical professionals really have seen it all. So there's no need to be ashamed or try to sugarcoat anything for them. It's definitely more harmful if you provide false information. If you are claiming that, oh, I quit smoking, 2 years ago, but you've been smoking recently, it actually does impact a surgical procedure quite a bit, and it could harm you in the long run. So it's okay. They're not going to judge you. Striving to maintain that objective attitude, stay focused. What's my goal? What's important? Maybe that's something you want to write down. Maybe my goal today is to blank. And that's what you want to write on the top page of your paper that you bring. And follow through with the plans that you've agreed upon. This helps to build trust with you and the provider. It's also a justification for insurance companies. They'll continue to pay for that care because you've attended every single appointment. You've been trying all of these things. Insurance tends to not like it when folks ditch out on their treatments and then they show up in the emergency room and they need an emergency type of treatment because it could have been prevented, but it wasn't. And now I don't know, I don't want to claim that I know tons and tons about insurance. This is just from my experience, what I have observed. If you don't wish to follow a plan of treatment, if you're not happy, be clear, be very upfront, let your provider know as soon as you make that decision. This way they're able to process through this reasoning. Well, why is it that you've chosen to not follow through with this treatment? I believe that this will really help you, and you're saying that you're not going to do it. So what can we do to absolve that issue? Also making considerations for folks with disabilities. Do they have difficulties with different forms of communication? Is there memory deficits going on? Do they need hearing aids? Are they able to see? Maybe they have a visual field cut from a stroke that they've experienced, or expressive receptive aphasia, mobility issues, impulsivity, displaying inappropriate behaviors, or just have this kind of blank overall, I'm going to shut down when I'm overwhelmed. So all this information coming at me is too much. Is really important to help identify these issues early so you can provide that support, limit the barriers for treatment. Being very upfront, addressing these right away at the beginning of the visit is going to help so that provider, that medical provider, can continue to adapt during that conversation, or they'll recognize when an advocate might speak up to say, you know what, I think this is too much. Can we take a break for a few minutes? Chances are that medical provider has a lot of patients waiting down the hall. Maybe they can go see someone else and come back. Oh, yes, literally write it down. I think I've made a few slides with this suggestion now. So this is how important I find it. And writing things down is the best way to success. And really the point of note here is to pre-write a card, maybe an example of what is going to be helpful for this provider to know right up front. I've seen patients do this with very good success. Like example of this would be something very concise and direct. Hello, I struggle with a memory deficit that makes it difficult for me to remember things we discussed during our visit today. Please provide me with written information to review following this medical appointment. This will let the provider know right up front what you're expecting at the end of the visit. You've identified what deficit you have and how to address that concern. How can you help me by providing this information in a written form that I can continually review as I need to? So these are ways, to help patients across the board, no matter what their deficit is, if they're able to have a script, something that's written ahead of time that allows that person to communicate what they need to. So as we reach the end of this presentation, my final thoughts for you. Unfortunately, after a lot of consideration, it just does take a little extra work for individuals with disabilities. So taking the extra time and preparing ahead is very helpful and important when making healthcare choices and managing those situations. There are many factors, including the complexity of care. And when you get those increased numbers of providers, you have a lot of specialty doctors involved, making sure that everyone is communicating with each other, making sure that they're all communicating with you and the people that are involved in your healthcare, especially after an acquired disability, those numbers tend to shoot up. And it'll be a unique and personal journey for everyone. And you'll want to try and discover the best techniques that work for you when it comes to communication or being an advocate. Feeling in control of your healthcare is very empowering, and it's very, very helpful to develop these strategies and take some time with it. No one's going to get it perfect right away. I think we can all agree that we're all likely to require some medical intervention throughout our lifetime, and learning how to communicate and continually practicing that throughout our lives is going to help us all to understand the medical professionals and to receive those beneficial outcomes. So there is no one way. Be honest, be respectful, and be heard. Thank you, everyone.